Hello, this is Anne Marie. Sorry for the wait there as I was getting everything ready for this on my computer. So I am here to talk to our first year DMP students, both FNP and PsycNP, about evidence-based hand hygiene for healthcare workers. And I just want to start by saying that I imagine that a number of you have seen similar presentations or heard similar advice. So, but it's imperative, I think, we cannot stress enough in this world, it's really the post-antibiotic era. We have so much antibiotic resistance, and we know that it's really imperative on all of us to prevent infections in the first place. So hand hygiene is definitely the place to start for that. So please bear with me. I will also give you a plain set of my slides, or give them to Esther, I'm sorry, to upload to the WIO course shell for 5825. So we'll start with a pop quiz. So I am not going to read these aloud. Instead, I'm just going to give you about 20 seconds to go through each of these questions and answers, and just kind of keep tally for yourself on, or keep score for yourself, or not keep score for yourself, but answer them on your own. You don't need to write them down. I think you'll remember them. Next one. Another one. VRE is vancomycin resistant enterococci. Another one. Oh, those were out of order, sorry. Another one. Another one. Okay, so we'll go over, or I think the answers to them will become apparent during this presentation. So to begin, nurses have always been at the forefront of infection prevention, and there's Florence Nightingale, and she was really very modern, way advanced in her time regarding infection prevention. However, I want to step back in time a little bit and not talk about Florence Nightingale, but talk about this wonderful man who I believe is from Austria, Dr. Semmelweis, and he died in the mid 1800s, but he is really the father of hand hygiene. And he was a physician who worked in Vienna, and he noticed that, and he actually conducted some research regarding two different obstetric clinics in their general hospital. And one of the clinics was staffed by physicians and medical students, and another one was staffed by midwives. And I'd like to think that those midwives were nurse midwives, but there was no such thing as a nurse midwife at the time. These were just lay women who had, I'm sure, experiential training in midwifery. What he did was he just tracked maternal mortality rates, and that was in the year of 1842, and noticed a huge difference in the maternal mortality, which was much higher in the physician group than in the second clinic, which was the midwifery group. There was also a lot of infant mortality, and I apologize, I do not know whether the numbers on the y-axis refer to hundreds of thousands. I don't even know what the denominator number is, but in any event, there were significantly more at least 2 times, if not more, in mother deaths in the women who were treated by physicians and those who were treated by the midwives. And he realized then that what these midwives were doing, sorry, not nurse midwives were doing, was that they were scrubbing their hands with a chlorinated lime solution in between the women that they helped with deliveries. So, and he theorized that that might be why the infection rate was lower, and really got into the germ theory. It's after 2. If you know anything about me, you know that after 2, my speech starts slurring. So, so really, he was the first one to realize that that was an important intervention. Sadly, he was not believed in his day, and really tried to share his theory of germs and what we could do to prevent infections. But sadly, the people at the time did not believe him, and he actually apparently died in an insane asylum. So that's a sad story. But Dr. Semmelweis is known as the father of modern infection control and hand hygiene. So at this point, I want to talk a little bit about colonization versus infection. It's important to recognize the difference between colonization versus infection. So people who carry bacteria without evidence of infection, so people who don't have a visible wound or fever or increased white blood cell count, all of those kinds of things, but still carry the bacteria, are considered colonized with the bacteria. We know that, for example, nowadays, that many people are colonized with MRSA who do not actually show signs of infection. There are also people who are carriers for strep pyogenes, which is the strep infection that causes strep throat. And they don't have strep throat, but they're colonized with it. If an infection develops, it's usually from bacteria that colonize patients. So people who are colonized with the bacteria can transmit their bacteria to someone else, either themselves or by the hands of a healthcare provider. So we need to be concerned about hand hygiene, not only by those who are infected, who are clearly infected, but also those who are not. We don't know who's colonized or not. Sometimes we know. Sometimes we know if somebody is colonized with MRSA or strep or something like that. But oftentimes we don't know. So we need to treat everybody as if they were colonized, and regardless of whether they are infected or not. So this is just an example of what they consider the iceberg effect for colonized versus infected individuals. You know, we see people who have infections. It's kind of the tip of the iceberg. However, the bigger problem are those who are colonized with an infection and who are not showing the symptoms of it. So we could all go out and use chlorinated lime solution to prevent the spread of infection to our patients. Fortunately, we don't have to do that. Can you imagine? That sounds terrible. And I can only imagine the condition of those midwives' hands from using that solution. Plus, they didn't have all of the moisturizers that we have now. So we're going to talk now about hand hygiene in the postmodern, post-antibiotic era. And it truly is the post-antibiotic era. You know, about 80 years ago or so, we were right on the cusp of the antibiotic era. However, within about 10 years of penicillin being introduced, we first recognized antibiotic resistance, and we have continued to try to play catch up to antibiotics and try to create new antibiotics to help us with microbes that have developed resistance to antibiotics. But we are definitely not winning that war, and probably never will. Microbes are very smart. They can genetically develop ways to get around antibiotics, and have been doing so since the earliest of antibiotics. So what I have in the next 2 slides are some research studies related to hand hygiene. I find them fascinating, and hope you will too. So if you'll excuse me for a little bit, because I will read a little bit from the slides for these. But the first one I want to show is from 2000. I mean, hand hygiene studies have been going on for a long time, but these were some that I found that were interesting. A randomized controlled trial with 52 nurses for 8 days from 12 medical and 4 surgical departments. The intervention was an alcohol-based hand rub versus an antiseptic soap. And the outcomes were they took samples before and after the hand hygiene and did microbiological analyses on these, so tried to grow out microbes. They also did a skin assessment using a standardized skin assessment rating scale, because we know that that is, in addition to how effective the hand hygiene method is on killing microbes, we also wanted to make sure that it doesn't damage our skin in the process. So the results for this were that the group who used alcohol-based hand rub were more likely to successfully decontaminate their hands than the hand wash group. And that was by, again, the microbiological hand samples. In addition, self-assessment of the skin condition and degree of skin damage was worse in the soap group. So there is some evidence that alcohol-based hand rubs are actually better for your skin than soap. So here's another study the year after that one, a randomized controlled trial of 50 full-time physicians, nurses, housekeepers, and respiratory therapists from 2 ICUs in Manhattan. We often think, I think anyway, of Manhattan and New York as being pretty dirty places where there'll be lots of infections, but that's my own bias. The intervention was one of 2 hand hygiene regimens randomly assigned over 4 consecutive weeks. So one was washing with antiseptic soap, and the other one was an alcohol-based hand rub with at least 61% ethanol. The outcomes that they assessed were skin condition measured by hand skin assessment and visual skin scaling form. And the second one was a microbiological sampling using a modified glove juice technique. And I believe what they do for that is they have these special sterile gloves that contain an agar of some type that people put their hands in, and then they pour out the juice and then try to grow out of the juice, the agar juice that are in there, try to grow microbes out of that. I believe that's how that works. Regardless, the results showed that subjects in the alcohol-based hand rub group had significant improvements in their hand skin assessment scores at week 4 and their skin scaling scores at week 3. So that's really their skin condition. So the alcohol-based hand group had better skin condition after 3 or 4 weeks. However, there were no significant differences in numbers of colony-forming units between the 2 groups. However, in addition, the alcohol-based hand group took significantly less time than the hand washing group and resulted in 50% cost reduction. Again, this study compared alcohol-based hand rub with an antiseptic soap, not just regular soap, but an antiseptic soap. So it showed no differences in the ability of these 2 regimens to reduce the number of microbes. However, those who used alcohol-based hand rub did have significant improvement in their skin. And of course, alcohol-based hand rub resulted in less money and in less time for the hand hygiene procedure. Next is a randomized controlled trial with 43 nurses, 9 nursing assistants, and 8 physicians. Each performed 6 different hand hygiene techniques in a random order immediately after patient care. So there was non-antiseptic soap for 10 seconds and 30 seconds. And then there was antiseptic soap for 10 seconds and 30 seconds or 60 seconds. And then last was an alcohol-based hand rub. So it was non-antiseptic soap and antiseptic soap for varying numbers of seconds, and then an alcohol-based hand rub. So their outcome was they took a culture from the fingertips of the dominant hands of these nurses and nursing assistants and physicians. They obtained 516 specimens, and they found that bacterial reduction after hand washing with an antiseptic soap or with using the alcohol-based hand rub was significantly greater than obtained from hand washing with an unmedicated soap, so a non-antiseptic soap. However, there was no significant difference between hand washing with an antiseptic soap versus the alcohol-based hand sanitizer. So that was similar to the study that we saw before, the Larson one, that found no difference in alcohol-based hand rub versus an antiseptic soap. Now, this study did not look at skin conditions, so we don't know whether these individuals had better or worse skin condition from using an alcohol-based hand rub. Moving on, a clinical trial with a crossover design in 2 NICUs in New York City. And they used 119 nurse participants. 2 hand hygiene products were tested, a traditional antiseptic hand wash and an alcohol-based hand sanitizer. Each product was used for 11 consecutive months in each neonatal intensive care unit in random order. Now, they found no significant differences in infection rates or mean microbial hand counts. However, they did find that skin condition in nurses was better when they were using the alcohol-based hand sanitizer. Now, I do not know how valid this study was, so I do not know whether the people actually were strictly using alcohol-based hand sanitizer or strictly using antiseptic hand wash. And that would be important to know to make sure that they weren't accidentally switching over or perhaps even using something different at home, which could have impacted their results. However, similar to a few other studies, no difference was found between alcohol-based hand rub and the antiseptic, alcohol-based hand rub and the antiseptic soap. Again, it gets after 2 o'clock. Okay, so in terms of time spent cleaning hands, this is a study of nurses who were in ICU, 12 nurses, and those who were hand washing with soap and water spent 56 minutes doing that versus the alcohol-based hand rub, they spent 18 minutes doing that. So it was almost 3 times as long to wash your hands as it was to use alcohol-based hand rub. And again, the hand rub seems to be easier on our hands, gentler on our hands. So the bottom line from all this research, no more research studies that I'm going to throw at you, or at least not until a little further along in the presentation, is that hand hygiene with either alcohol-based hand rub or an antiseptic soap results in generally better results generally in similar decontamination. Hand hygiene with non-antiseptic soap is less effective than hand hygiene with alcohol-based hand sanitizer or antiseptic soap. And then using an alcohol-based hand sanitizer is easier on the skin, less costly, and takes less time. Now, want to make sure, I hope you guys know this, but if not, alcohol-based hand sanitizer does not clean soiled hands or kill spores. These must be rinsed off with water. So some spores, if you can't think of any spores, I will share some with you. Giardia, something that we see oftentimes in the West, especially in the summer when people are out camping and hiking and fishing, drinking from contaminated water sources. Another one is Clostridium difficile. There are others, but those are 2 of the ones that we see kind of commonly. C. difficile is on the rise, and we're seeing a lot more antibiotic resistance to C. difficile, Clostridium difficile. Those are both spores. They would not be killed by alcohol-based hand sanitizer. They must be rinsed off the hands. Okay, so this gets us to recommendations for outpatient settings, which is primarily where you guys are going to be as DNP prepared FNPs and psych mental health NPs. So key situations where hand hygiene should occur. Please, please, please put these to memory before touching a client, even if you plan to wear gloves. Before exiting the client's care area, after touching the client or touching anything in the client care area. So it's not just if you touch the client, but if you touch anything in the client's room. So unless your hands are completely to yourself, maybe you've got your arms folded or something like that, you need to be doing hand hygiene before you exit the client's care area. Clearly, you need to be doing hand hygiene after contact with body fluids or wound dressings. You need to be doing hand hygiene prior to performing an aseptic technique, such as performing an injection, removing hands from a contaminated body site to a clean body site, and then after glove removal. So I also want to stress here, because this is the first year, or no, this is the second year, never mind. This is the second year that we have psych students, that this is not just for patients who present for a typical primary care type of situation. This is even for people who present for mental health, that you need to be doing hand hygiene before you touch the client or after touching anything in the client care area. So even in an exam room, counseling room, anything like that. It's just a good habit to get into doing hand hygiene. They recommend soap and water when hands are visibly soiled or after caring for patients when known or suspected infectious diarrhea. Otherwise, they say that the preferred hand hygiene technique is alcohol-based hand sanitizer. So in other words, use alcohol-based hand sanitizer unless your hands are visibly soiled or after caring for patients who have a suspected infection such as diarrhea. So you can get those spores off. So recommended hand hygiene techniques, just to explain a little bit more. Hand rubs, alcohol-based hand rubs. You apply to the palm of one hand. You rub hands together, covering all surfaces, and then let them air dry. The volume of the hand rub is based on the manufacturer. You oftentimes will see 10 cc's, which is 2 teaspoons. In terms of hand hygiene, wet hands with water, apply soap, rub hands together for at least 15 seconds. Rinse and dry with a disposable towel, and then use your towel to turn off the faucet. Another good practice is if you're in someplace with a door, to use the disposable towel to open the door so that you won't get the germs of the people who went before you who did not wash their hands but yet touched the doorknob or the door. Okay. So something a little bit different, talking about artificial and polished versus natural nails. So this is a study. It's a long time ago. There hasn't been a lot of research in this area. However, what it shows here is that bacteria have been recovered from nails, both natural nails, artificial nails, and polished nails. You can see the results here. The natural nails have the least amount of bacteria recovered from them. Polished were about twice as much. And then artificial nails had about 7 times the bacteria recovered from them as natural nails. So the recommendation is to avoid artificial nails, keep natural nails very short if caring for high-risk patients. And actually in the GMP handbook, we have a policy regarding length of nails, and I encourage you to look at that if you haven't done so recently. I don't know if I have anything more to say with this. Keep your nails short. Avoid artificial nails. Some unresolved issues regarding hand hygiene are the use of non-alcohol-based hand rubs. There are some hand rubs that use different chemicals versus alcohol. And then wearing of rings in healthcare settings is another issue that we have not resolved yet. But you can imagine rings can harbor bacteria as well too. So you could consider not wearing rings in a healthcare setting, especially if you're with high-risk patients. All right, so let's get back to the quiz. And again, I'm just going to let you read the questions and see if you've improved on these. So hopefully you would do this more often now. There has been a lot of, I do hear a lot, just to scuttlebutt around, that organisms are becoming resistant to alcohol, but really there's been no indication of that. And you could easily argue that there are 2 correct answers to this one: antimicrobial soap and water and alcohol-based hand rub. Hope you would definitely answer alcohol-based hand rub. Don't know that the correct answer is really here, but about 30 minutes. And one more question just for the fun of it. So the answer there is definitely bacterial spores. Bacterial spores like Giardia and Clostridium difficile. Okay, so clearly hand hygiene saves lives. You know that from nursing school, for some of the work that you have done as nurses, and that prevention is primary. We can protect patients, we can protect our communities with good hand hygiene. However, many people are still not doing hand hygiene regularly. So here's a study from 2014. It was a study of basic safety skills in new medical residents. They simulated a scenario with nurses serving as patients. So the nurses were the Confederates. And they completed standardized scoring tools on the residents. Only 66% of the residents performed hand hygiene before or upon entering the patient's room. So, and that doesn't even the study didn't even look at whether they were doing hand hygiene prior to exiting the room, but only 2/3 of them were performing hand hygiene before actually seeing the patient. So be a part of the majority, be a part of that, of the residents who did do this, and I hope that you will be closer to 100%. So stethoscope care. I wanted to talk about this as well too, because stethoscopes are something that people typically own, don't use their own stethoscope unless they're in an ICU setting or bone marrow transplant setting or something like that, where maybe they do require that you use certain sterilized ones. But for the most part, most of us use our own stethoscopes. We may even take it home, keep it in our car, keep it in a bag, keep it in a drawer, you name it, and we use it on the same people day in and day out. So here's a study that compared an ethanol-based cleaner to isopropyl alcohol pads in reducing bacterial decontamination of stethoscope diaphragms. 99 stethoscopes were cultured from professionals on 4 medical floors before and after cleaning with ethanol-based cleaner or the isopropyl alcohol. And the isopropyl alcohol significantly reduced colony counts, but neither was statistically significant. So that just shows that some type of cleaning of our stethoscope diaphragm can reduce colony counts. That's not something that people have routinely done in the past, clean their stethoscope in between patients, but it's a good idea. Ethanol-based cleaner or isopropyl alcohol was found to be significantly decrease bacterial colony counts in this study. Another study to investigate whether simultaneously scrubbing hands and the stethoscope diaphragm with an alcohol-based foam will reduce bacterial counts on the stethoscope. So you could imagine doing both, your hands and your stethoscope at the same time. So once the diaphragms of the stethoscopes were dried, they were imprinted on a bacterial culture plate. Results from 184 cultures, and both the mean and median colony counts were significantly greater before being cleaned. There were 3 MRSA colony counts identified in the pre-wash period, and they were all destroyed by the foam. So does this make sense? They actually imprinted their stethoscopes on a culture plate before cleaning it and then after cleaning it. They cleaned it with a alcohol-based foam, hand sanitizer foam. So these people cleaned their hands with the alcohol-based foam, and then they rubbed the foam on their stethoscope and found that this worked. This reduced bacterial counts, and it destroyed all 3 colonies of MRSA that they found on the pre-stethoscope sanitization process. So that's pretty cool, and that's an easy thing to do. Do your hands and your stethoscope at the same time. Okay, another study, a convenient sample of 84 medical students, residents, and attending physicians at a large hospital in Atlanta. They compared rubbing stethoscope with isopropyl alcohol with an isopropyl alcohol wipe. That's just a simple wipe that you would use, prior to doing an injection or an IV start or something like that, versus an alcohol-based hand rub. Now, here are the plots of all of the data points before and after the hand rub and the alcohol wipe. Notice that the colony counts before cleaning with the hand rub, so the stethoscopes that were cultured before cleaning with the hand rub, they were had significantly more bacterial counts for some reason. We don't know why. And then versus the third column, which is before cleaning with an alcohol wipe. So the people who cleaned their stethoscope with the hand rub, their stethoscopes were dirtier to begin with for some reason. So then you can see what happened after cleaning with the hand rub and then after cleaning with alcohol wipe. So the alcohol wipe in this case looked a lot better. There were significantly fewer bacteria after cleaning with an alcohol wipe than cleaning with a hand rub. However, that could be skewed a little bit because the stethoscopes that were cleaned with the hand rub were so much dirtier in the first place. There were so many bacteria from them in the first place. Okay, so that's just with stethoscopes. What about other items such as lab coats, ties, cell phones, pens, all of those kinds of things, keyboards, you name it, the data are mounting. These items are commonly contaminated with bacteria. So be aware of this, limit their use in your practice and keep them clean as much as possible. Banishing handshakes. So, the handshake, I'm from the South, and I was brought up to shake hands with everybody when I meet them and when I greet them. And that has definitely been a big part of my professional practice. But there have been some studies that have looked at that, and they're saying that might not be a great idea, a great way to greet people, especially clients who are more at risk. So some proposed handshake alternatives are the fist bump. Apparently there is some research to show that you're much less likely to spread infection with a fist bump than namaste, where you bow to the person and don't even touch them at all. Those are just some examples of things you can do to avoid spreading bacteria. At a minimum, this is something that that even challenges me, is that when I enter a room, I still am doing handshakes. I still haven't gotten into fist bumps or namaste. However, I am not shaking hands with people until I have cleaned my hands. And I try to put hand sanitizer on my hand as I'm entering the room for two reasons. One, I want the person to know that I am decontaminating my hands. And two, if people are kind of extroverted and stick out their hand for me to shake, they know, oh, she's spreading hand sanitizer on her hand. I need to wait a few seconds before I shake her hand, otherwise my hand will get wet. So that's why I do it as I'm entering the room, and I encourage you to do the same. Okay, so kind of at the end here. So please take care of your hands. Use hand hygiene. Use hand sanitizer. Wash your hands, especially if they're visibly soiled or if you're around people with infectious diarrhea. Avoid artificial nails. Keep your nails short. This device at the top right and at the kind of middle bottom are devices that are supposed to decontaminate stethoscopes. When you wear lab coats, please launder them. Do not wear them for days on end. Launder them each day in hot water. Avoid wearing ties, and consider avoiding wearing rings as well too. So, but most importantly, never ever forget that Florence Nightingale is watching you, and she did a lot to prevent infection in the Crimea War, and she's not as well known for her infection control measures as Semmelweis, but she's very important to infection control. So I think that's all I have. And there are some references. I appreciate your time, and that's all for now. Take care. Bye.